Hello, Dr. Rosenthal here. We're going to look at the upper cervical vertebrae, C1 and C2, and look at some of the unique features found here. Other names for these vertebrae: for C1, we have the atlas, and for C2, we have the axis. And when we rotate our head, a good portion of that, as much as 50%, is occurring between C1 and C2 at this atlantoaxial joint. All right, so C1 does not have a spinous process. It only has a posterior tubercle. It has an anterior and posterior arch. It doesn't have a vertebral body. It has lateral masses. Let's take a look at that. Lateral masses. This structure right here, developmentally, would have been the portion that would form the vertebral body of C1, but instead it fused to C2 very early in development. It's called the dens. It's also referred to as the odontoid process. It projects superiorly from the vertebral body of C2 and articulates with the anterior arch of C1. There's a ligament, the transverse ligament of the atlas, that is very important, and it attaches from one lateral mass to the other lateral mass in the vicinity of my pointer. And it keeps these two bones from translating relative to each other. If this ligament is ruptured during a traumatic accident and C1 is allowed to translate anteriorly relative to C2, this will likely sever the spinal cord and be lethal. C1 is a very wide, it's the widest cervical vertebra. The transverse processes coming all the way out to these 2 points. It has a large transverse foramen. As the vertebral artery passes up and through it, it then bends and passes around this groove right here, or shallow trough. And this space is for the vertebral artery and the C1 spinal nerve. These large concave articular surfaces are for articulating with the occipital condyles of the skull, which I'll briefly show you right now. These are the occipital condyles that articulate with C1. And the motion that occurs between the occipital condyles and C1 is a rocking motion, a nodding motion, as compared to the motion between C1 and C2, which is a rotational motion at this pivot joint. Okay, let's look at C2 in more detail. We described its odontoid process, or dens. It has features that are similar to other typical vertebrae, with the transverse process and foramen. It also typically has a large bifid spinous process. Those are some of the unique features of C1 and C2. Thank you.